Hi, guys, and welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners internationally with exam success. I have been doing this since 2015, assisting nurses and nurse practitioners. Now, I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 50-year-old male with a history of chronic alcohol use and obesity presents with sudden severe pain, swelling, and redness in his right big toe. On examination, the toe is warm, tender, and visibly inflamed. Uric acid levels are above normal. What is the most likely diagnosis? Is it A, rheumatoid arthritis, B, osteoarthritis, C, gout, or D, Morton's neuroma? Take a moment and tell me what you got in the comments, you guys. All right. So y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, what is the most likely diagnosis? And y'all know I tell y'all, if it's asking for a diagnosis, you need to run it back and look at the assessment findings. So think about how they're presenting, think about their signs and symptoms, think about the chief complaints, think about what is noted on exam. So this 50-year-old male has a chronic history of alcohol use, obesity, and he comes in complaining about sudden severe pain, swelling, and redness to the right toe. And on exam, nurse practitioner notes that it is warm, tender, and is visibly inflamed. Uric acid levels are above normal. So y'all, this is classic presentation for gout. So C is your best answer. Question number two. A 60-year-old male with a history of chronic gout presents for follow up. His serum uric acid level is 8.5 milligrams per deciliter, and he has had multiple episodes of acute gout attacks in the past year. Which of the following is the most appropriate treatment to prevent future gout attacks? Is it A, allopurinol, B, colchicine, C, ibuprofen, or D, methotrexate? Take a moment and tell me what you got. All right, so the stem of the question here states, which of the following is the most appropriate treatment to prevent future gout attacks? Now, y'all know, I tell you, if the STEM is looking for treatment options, you need to run it back and see if they have provided you with a diagnosis. And they have, it's looking for the treatment of future gout attacks, right? So you want to start to consider how you treat gout. And then I always tell y'all to think in the components of acute versus prophylactic. Now, although this patient has had multiple acute episodes and attacks, they're looking for the treatment to cover them in the future to prevent those acute attacks. So now we're talking about prophylactic treatment, right? So in the event that we are treating prophylactically, we use allopurinol for the management of gout. And so Brittany's Brilliance, I tell y'all to think about the word all in allopurinol because it treats you for all the time. Whereas for acute treatments, we use colchicine and NSAIDs, okay? And then lastly, question number three, a 45-year-old male with a history of gout presents with a painful swollen right great toe that started suddenly 24 hours ago. The toe is warm, erythematous, and tender to touch. He is unable to bear weight on the affected foot. His serum uric acid level is 9 milligrams per deciliter. Which of the following is the most appropriate next step in the management of this acute gout attack? Is it A, start oral corticosteroids, B, start allopurinol immediately, C, start colchicine, or D, no treatment is needed at this time? Take a moment to tell me what you got, you guys. All right, so stem of the question here states, which of the following is the most appropriate next step in the management of this acute gout attack? Look, this stem tells you everything. It's looking for a treatment. It already has the diagnosis of gout, and it also lets you know it is an acute attack that we're treating. We just talked about this. So, what is the acute treatment for gout? We're either using colchicine or NSAIDs. So C is your best answer. You want to start your colchicine. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. The things that I do offer are my review book. You can get it either in an ebook or paperback option. They're both linked in the bio of this channel. My self-paced review, if you're someone who prefers to study independently for family and adult Gero, is also linked in the bio of this channel. If you are needing flashcards, I have released those digital flashcards. They are linked in the description of this video because right now for early release and access, I have them priced at $59. And if you need to do any practice question, my QBank options are linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, y'all know I tell y'all to either call, text, or email because I offer a variety of one-on-one session types, and I prefer to speak with you to gauge what you truly need so that we can make sure that you're booking the appropriate session. All right, you guys, as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.